Avian influenza, or bird flu, is a virus that primarily infects birds. This virus is highly contagious among bird species and can spread rapidly through both wild and domesticated bird populations. It's a serious concern because some strains, like H5N1, can spread to humans. When this happens, it can lead to severe respiratory illness and even death in some cases. While rare, these cases can be severe, highlighting the importance of understanding and preventing this disease. Public health organizations closely monitor outbreaks to prevent potential pandemics. Avian influenza viruses exist naturally in bird populations. These viruses are often found in waterfowl, which act as natural reservoirs. Waterfowl, like ducks and geese, often carry the virus without getting sick. They can spread the virus to other birds through their droppings, saliva, and nasal secretions. However, the virus can be deadly to domesticated birds, such as chickens and turkeys. Infected birds may show symptoms like sudden death, lack of energy, and decreased egg production, which can have devastating effects on poultry farms. The H5N1 virus typically spreads through contact with infected birds. This virus is highly contagious among birds and can be found in their saliva, nasal secretions, and feces. When birds are kept in close quarters, like in poultry farms, the virus can spread rapidly, infecting entire flocks within a short period. This can include direct contact with live birds, dead birds, or their droppings. Farmers and workers in poultry farms are at a higher risk due to their constant exposure to these birds. Handling infected birds without proper protective gear can lead to the virus entering the human body. People can also get infected through contact with contaminated surfaces, like cages or equipment. The virus can survive on surfaces for several hours, making it easy to transfer to humans who touch these surfaces and then touch their face, mouth, or eyes. While human-to-human transmission of H5N1 is rare, it is possible. This usually occurs in cases where there is prolonged and close contact with an infected person, such as family members or healthcare workers who are caring for the patient. Close contact with an infected person, especially in a healthcare setting, increases the risk of transmission. Healthcare workers must use personal protective equipment to minimize this risk and follow strict infection control protocols. It's crucial to implement infection control measures to prevent further spread. Regular hand washing, using hand sanitizers, and following guidelines for infection control can significantly reduce the risk of H5N1 transmission. Public awareness and education about these measures are essential in controlling the spread of the virus. Avian influenza symptoms in humans can range from mild to severe. Mild symptoms resemble the flu, including fever, cough, sore throat, and muscle aches. These symptoms can appear within 2 to 7 days of exposure to the virus. Severe cases of H5N1 can lead to life-threatening complications. These complications include pneumonia, acute respiratory distress syndrome, and multi-organ failure. Recognizing early symptoms and seeking immediate medical attention is crucial for better outcomes. Treatment for avian influenza typically involves antiviral medications, such as oseltamivir, also known as Tamiflu. These antiviral drugs are designed to inhibit the virus's ability to replicate within the body, thereby reducing the overall viral load and helping the immune system to combat the infection more effectively. Another commonly used antiviral is zanamivir, known as Relenza. This medication is often administered via an inhaler, making it a suitable option for those who may have difficulty swallowing pills. These medications can help reduce the severity and duration of the illness, especially when started early. Early intervention is crucial, as it can significantly lower the risk of complications and improve recovery times. In addition to antiviral therapy, supportive care is essential for managing symptoms. Supportive care includes a range of measures aimed at alleviating symptoms and improving patient comfort. This may include rest, fluids, and over-the-counter medications to relieve fever and aches. Staying hydrated and getting plenty of rest are fundamental aspects of supportive care. In severe cases, hospitalization may be necessary for respiratory support and other intensive care measures. Intensive care units are equipped to provide advanced medical interventions, such as mechanical ventilation, to support patients with severe respiratory distress. Preventing avian influenza involves minimizing contact with potentially infected birds and practicing good hygiene. Avoid visiting live poultry markets or farms where outbreaks have occurred. If you must handle poultry, wear appropriate personal protective equipment, including gloves and a mask. Wash your hands thoroughly with soap and water after any contact with birds or their environments. Staying informed about outbreaks and following public health recommendations is crucial in preventing the spread of avian influenza.